The One3 user guide will now begin. How to use the One3, reviewing the tabs, patient, 3D, MPR, dental arch, implant, TMJ, report, reviewing the tabs in the order of diagnosis. Introducing the One3. Panorama images represent anatomical structures in a two-dimensional plane, while CT depicts the anatomical structure in 3 dimensions. One3 is a dental-focused software that utilizes reconstructed 3D CBCT images and provides various image analysis and simulation functionalities. It provides tools and functionalities specialized for users' intent to easily diagnose and analyze images. We will now go over the One3 UI configuration. The screen configuration is as follows. Consists of 6 various modules that can be utilized according to the user's purpose. The One3 has an optimized layout for viewing images according to the selected module. The toolbox is utilized accordingly as per the selected module. There are multiple modules available. First is the patient module. You can view and manage the image data stored in the One3. Various simulations may be viewed while utilizing the axial, coronal, and sagittal cross-sections in the 3D MPR module. The dental arch module provides a panoramic view of the CT image based on the dental arch created in the 3D MPR module. In the implant module, you can simulate an implant placement based on a panoramic view and also determine the site's bone density. In the TMJ module, you can view the cross-section of a patient's TMJ for diagnosis. In the report module, you can manage captured CT images and create reports. Now let's take a look at the One3 layout configurations. Each window consists of its own view title, maximize and restore, zoom in and out, axis and image information. View title displays the title of the screen. First subtitle, green for coronal, second subtitle, blue for axial, third subtitle, red for sagittal. The color-coded axis in the cross-section represents its own respective views. Maximize and restore allows to view the window in full screen. Select the button on the top right of the window to maximize and restore the view. The zoom in and out feature allows you to zoom in and out of the image by dragging the scale bar on the left side of each screen or by scrolling the mouse wheel. You can move and rotate the axis or adjust the thickness to see the image in the desired position. In the image information, you can check and adjust the TH thickness value, rendering type, and windowing value. TH thickness allows you to set the current thickness of the image. To change the thickness of an image, select the TH option. The larger the thickness value, the easier it is to determine the size or shape of the tooth. Click on Filter in order to select your option. The sharpening function enhances detail, but may cause noise as well. It is recommended to utilize the sharpening function with a higher TH value. The Color Map function provides an intuitive way to view an image based on differences in density. Click on MPR in order to select your option between MPR, MIP, or VR. MPR, Basic Grayscale Radiograph, MIP, compilation of the entire volume of data and projects in the visualization plane with maximum intensity. VR, Volume Rendering, allows users to visualize image in 3D. WWL shows the value of brightness and contrast. To adjust brightness, right mouse click, hold, and drag top to bottom, and to adjust contrast, right mouse click, hold, and drag left to right. Let's take a look at the One3 function tools. The Zoom function tool allows users to zoom in and out of areas for diagnosis. Once selected, left-click and hold the mouse on an image and drag up and down. Please note that the use of this tool will simultaneously zoom in and out for all 3 views. In order to zoom in and out for individual windows, left-click, hold, and drag the ruler located on the left-hand side of the image. The Pan function tool allows user to move an image. Select the pan icon, left-click, hold and drag to move the image. When zoomed in, reposition the image with pan to focus on area of interest. You may also move the image by clicking on the mouse wheel, hold and drag. The Invert function tool inverts black and white pixels to white and black, which may help users to identify oral pathology. The Capture function tool allows users to screen capture a CT image. You may capture a single image by choosing Select Image Capture, or capture the entire screen by choosing Full Screen Capture. Captured images may be viewed in One3 under the patient's thumbnail, as well as the Report tab in the One3. The Ruler function tool allows the user to measure length. Click between 2 points in order to measure the length of the area. You may use this tool to measure the width of an area, the distance between the alveolar ridge and the sinus, and so forth. The Tape Line function tool is used to measure the length of consecutive points. Double left-click to end the measurement. The 3-point angle function tool measures an angle based on selecting 3 separate points. It may be used to help determine the correct angle of implantation. The Profile function tool can be used to identify the density value between 2 selected points. Some recommended usages include identifying a fractured tooth, as well as to confirm dental restorations. The ROI function tool is a feature that is to be used only by radiologists. The Arrow function tool allows users to create an arrow to indicate pathology and/or to mark an area for treatment for patient consultation by left-clicking one point to another. The Note function tool allows the user to write notes on an image. You can delete an annotation by right-clicking on the object, then select Delete. The Dental Arch function tool constructs a panoramic cross-sectional view based on selected points along the dental arch. In order to acquire a full arch, scroll to the designated region in the axial view, select the Draw Dental Arch tool, then left-click individual points along the axis and double left-click to finish. The Draw Nerve function tool can be traced on either the sagittal or coronal view, and may be utilized for third molar extraction or implant placement in the mandibular region. The nerve is created based on the points that the user has selected. Double left-click to end the nerve tracing. The Insert Implant function tool allows for a quick and easy way to simulate an implantation by selecting a tooth number. Once inserted, the implant may be repositioned by rotating or by changing its location. The following features allow you to modify the area of the volume rendering, providing access to view unseen parts of the treatment area in 3D. First, let's take a look at the 3D zoom feature. The 3D zoom feature allows you to zoom in on a specific area and view it in a virtually rendered view. For example, it can be used to get an overall view of the shape for the region of interest. Select the Draw 3D Zoom button and zoom in. Select the VR region you want to view by dragging the mouse on the cross-sectional image. You can use the clipping function to view bone sections or unseen areas of the treatment area in 3D. You can exit the function by clicking on Close 3D. The Sculpt feature within the Segment function allows you to sculpt out a selected area and remove that portion. The Sculpt feature gives you the freedom to adjust the volume view area into any shape you want. The pick icon will automatically split areas with similar values to the selected location in the 3D volume view. you can see the history of the cut in the object list and reset it by selecting the All button. Select Close Segmentation to exit the segment. You can make the sculpted history visible or invisible in the 3D object list. The clipping feature allows you to easily crop the volume view in a rectangular shape by dragging the mouse. The tool display box allows you to set whether to show selected feature on an image. You can check the feature in the tool display box to display it on the image and uncheck the feature to remove the feature. You may toggle on and off the cross section by pressing the Enter key. You can reset the image by utilizing the Initialize tool. The View function resets the view of all images to its default setting, including the orientation and the WWL. The All function resets all images to its default setting, including all the tools used on images. The Save function allows you to save your case study. If the One3 is not linked to the One2, your saved case study may be found under the Series tab in the Patient module. You may export the image by selecting the Save button, then by selecting Export, Non-Compression. The Patient module. The Patient tab is a module that manages patient data. If the One3 is linked to the One2, the Patient tab will not appear. You may either search for data by typing in the search bar, or you can search by filtering the dates. You can view searched or saved patients in the study list. You can view the patient's image information under the study and series. In the Preview section, you can see the patient's image information under the study and series. Let us now talk about the coronal, sagittal, axial, and VR window. The axial, coronal, and sagittal window in the 3D MPR enables a quick overview of the anatomical structure and pinpoint exact distances. You may create preoperative simulations by utilizing tools such as the implant and nerve tracing tools. Individual windows do not operate independently, but rather all 4 windows are collectively looking at the same area in different views. The axial view is a horizontal plane that is perpendicular to the coronal and sagittal view. As the axis moves up and down, it helps to determine the shape of the pulp and to understand the symmetry of the dentition. The blue line in the axis of both the coronal and sagittal window represents the axial window. When you move the mouse up and down in the axial window, you can also see the blue axis moving in both the coronal and sagittal window. By changing the overlay setting in the 3D window, you can have a better understanding of your placement. The sagittal view allows the user to view the anatomy from lateral to medial. It can be used to identify the nerve and to view teeth, both buccal and lingual. As the red axis line represents the sagittal window, it is difficult to properly view the anatomy without rotating its axis. Rotate the red axis in the axial window to run parallel to the quadrant of interest. Scroll the mouse wheel in the sagittal window in order to view the anatomy from buccal to lingual. By changing the overlay setting in the 3D window, you can have a better understanding of your placement. The coronal view allows the user to view the anatomy from anterior to posterior. The green axis line represents the coronal window. As you scroll the mouse while hovering over the coronal window, you'll notice that the green axis lines in both the sagittal and axial window move from anterior to posterior. By changing the overlay setting in the 3D window, you can have a better understanding of your placement. The VR window provides a 3D volume rendering of the captured image. You can view the shape of the teeth, bone, and tissue of the patient, of which can be used during patient consultation. The overlay on the 3D window helps you to know your placement. Right-click mouse, hold and drag, or select a preset position icon to change the orientation of the 3D rendering. Double left-clicking on a specific part of the anatomy within the 3D VR focuses the view to that site within all windows in the 3D MPR. You can change the way you view the overlay and unshaded VR. The outline function displays the outlier of the coronal, sagittal, and axial window. The MPR function displays the MPR view of the coronal, sagittal, and axial window. By default, teeth and bone are set to be most visible, but it may be manually changed in the VR setting. The settings may be changed to make the bone-oriented structures most visible. Since darker areas have higher density values, prosthetics, as an example, will appear worse. In such scenarios, you may use the OTF graph to adjust the values. We will now review how to properly identify and trace the inferior alveolar nerve. In the axial window, drag the cross-section to the region of interest and scroll down the mouse until you reach the mandibular region. Identify the nerve in the posterior region and rotate the red sagittal axis to align it to run through the nerve. Rotating the axis in reverse will cause the image to be inverted. When tracing the nerve on the right side of the patient, the red sagittal axis line should rotate right. When tracing the nerve on the left side of the patient, the red sagittal axis line should rotate left. You can identify the inferior alveolar nerve in the sagittal window. Select Draw Nerve. Left mouse click through the path of the nerve in the sagittal window. Scroll the mouse wheel to find the continuation of the nerve if not present. Double left click to end the nerve tracing. In the axial window, drag the cross-section to the region of interest and scroll down the mouse until you reach the mandibular region. Identify the nerve in the posterior region and rotate the red sagittal axis to align it to run through the nerve. You can identify the inferior alveolar nerve in the coronal window. Select Draw Nerve. Left mouse click through the path of the nerve in the coronal window. Scroll the mouse wheel to find the continuation of the nerve if not present. Double left click to end the nerve tracing. We will now review how to create a dental arch. In the axial window, scroll towards the area of interest until you are able to view the roots. Select Draw Dental Arch. Draw a dental arch by clicking through the roots. Double left click to end. You will automatically transition to the Dental Arch tab, where you can make modifications to the arch in the Scout view. We will now review how to place a digital implant through the implant simulation. Focus the cross-section axis to the region of interest. Draw the nerve. Measure the crestal ridge and the distance from the crestal ridge to the nerve. Select Insert Implant. Select the correct size implant for the site. The selected implant will be placed directly on the cross-section axis. You may freely move and rotate the implant to make any adjustments. We will now review how to use the Dental Arch module. The dental arch module allows you to view a CT image as a panoramic view. In the 3D MPR tab, select Draw Dental Arch and trace the arch. In the Dental Arch tab, you can automatically create a dental arch by selecting Auto, or you can manually create a dental arch by selecting Manual. The cross-section windows are based in 1 mm intervals, of which are represented on the top left corner of the individual windows. Up to 5 dental arches may be created per image, of which are recorded on the left-hand side. You may delete any unwanted arches by right-clicking on designated number. The panoramic image seen in the Dental Arch tab will appear distorted, unlike a normal panoramic image. The panoramic image is determined by the dots and lines created in the Scout view found on the bottom right. The panoramic image will change accordingly to any adjustments made. The dental arch can be viewed through the 6 cross-sections. The blue, highlighted border cross-section window directly correlates to the blue line found in both the Pano and Scout view. You can select which cross-sectional box to highlight by left-clicking on the box. Scroll the mouse wheel or left-click, hold, and drag the blue line in the Pano to change the view mesial to distal. The blue line in the Pano view is able to be rotated. Toggle the line according to the tooth axis in order to aid in accurate diagnosis. In the panoramic view, the purple line allows you to adjust between the maxilla and mandible in the Scout view. The blue line allows you to adjust between the maxilla and mandible in the cross-section window. You can also trace the nerve in the Dental Arch tab. Scroll the mouse wheel in the panoramic view to identify parts of the nerve if not present. Select Manual under the Nerve option on the left side of the screen and trace the nerve in the panoramic view. You can also measure length and angle in the Dental Arch tab. If you look at the panorama view in the Dental Arch tab in its default settings, it is difficult to see the jawbone or the overall shape. Increasing the TH value and adding a sharpening or MIP function can help you to better recognize the anatomical structures or the condition of teeth and bone that was not visible before. We will now review how to use the Implant module. The panoramic image in the Implant tab is created based off of the last dental arch created. Extend the dotted line in the panoramic view in order to extend the maxillary and mandibular regions. Select Manual under Implant, then select the corresponding tooth number. You can measure the length and angle in the Implant tab as well, but it is much more convenient to measure in the Dental Arch or 3D MPR tab. First, left-click on the crestal ridge of the location you want to place the implant, then drag your mouse towards the apex, then left-click your mouse again. You can modify the size, angle, and position of the implant while referencing to all the other views. You can change the length and diameter of the implant by selecting between the options. The bone density tool represents the surrounding bone of the digitally placed implant, measured based off of the Hounsfield unit, representing bone from D1 to D5. You can also use the bone density graph to determine the bone density inside and outside the implant. In the graph, the dotted line represents the inside of the implant, and the solid line represents the outside of the implant. The numbers on the left part of the graph show the length of the implant fixture. We will now review how to use the TMJ module. The TMJ tool is used to diagnose patients with temporomandibular joint abnormalities. Hover the cursor above the Scout view and scroll the mouse wheel in order to find the condyle. Select Draw TMJ line. Generate a cross-section by selecting a start and end point that aligns with the TMJ. Creating a cross-section on one side of the TMJ will automatically create a symmetrical cross-section on the other side. If the point selected for the cross-section does not align to the point of interest, you can freely make any adjustments. Hover the cursor above a cross-section window and scroll your mouse wheel to easily diagnose. We will now review how to use the Report module. In the Report module, you can manage captured images and create reports. You can find the Report toolbar, template to create a report, and a compilation of all captured images. History allows you to view and recall any past reports created for the patient. The Save button allows you to save the report as an image. The Export Report button allows you to export the report as a PDF file. Select Add Page or Delete Page to add an additional page or to delete a page. Select Change Template to change the template of the report. Select New Report to save the current report and to create a new report. Select Change Layout to change the layout of viewing captured images. The Export and Delete button allows you to either export the captured image or to delete it. The Save button allows you to save the entire contents of the Report module. The following is how to create a report. From the list of captured images, click and drag the image you want to include in the report. Write any notes you would like to include in the report. Select Add Page to add an additional page. Select Delete Page to delete a page. If necessary, you can change the template to create a report that fits your style. You can change the clinic information that is shown in the report by selecting the settings icon on the top right of the page. Select Clinic Information, then edit the clinic info. You can save the report as PDF by selecting Export Report, or as an image file by selecting Save. Saved images can be exported, then imported into a PMS program. We will now review how to utilize each module to make proper diagnosis. First, we will discuss how to diagnose implant placement in the posterior maxilla. Move the blue axis in both the coronal and sagittal window towards the maxilla. Position the blue axis so that the teeth are clearly visible in the axial window. Position the cross-section to the tooth you want to diagnose in the axial window. Rotate the red axis to align with the center of the arch in the axial window. Rotate the green axis to align with the direction of the tooth in the sagittal window. Once a dental arch has been created, it will automatically transition you over to the dental arch module. Rotate the axis and adjust the image in the dental arch for the treatment area. Measure the bone width and the length towards the maxillary sinus using the ruler tool. If there are insufficient length necessary for implantation, procedures such as maxillary sinus augmentation can be performed in order to gain sufficient space. You can place an implant simulation in the implant module based off of the measurements taken in the dental arch module. Select the manual button and choose the icon with the number that corresponds to the tooth. Left-click and drag the mouse towards the apex to match the intended length of implantation. Implant angle and position can be modified as needed. We will discuss how to diagnose implant placement in the anterior maxilla. Move the blue axis in both the coronal and sagittal window towards the maxilla. Position the blue axis so that the teeth are clearly visible in the axial window. Position the cross-section to the tooth you want to diagnose in the axial window. Once a dental arch has been created, it will automatically transition you over to the dental arch module. Rotate the axis and adjust the image in the dental arch for the treatment area. You can locate the position of the incisive canal as you move through the image, which allows you to make proper diagnoses. Use the ruler tool to measure the bone width and length of the implant site. You can place an implant simulation in the implant module based off of the measurements taken in the dental arch module. Select the Manual button and choose the icon with the number that corresponds to the tooth. Left-click and drag the mouse towards the apex to match the intended length of implantation. Implant angle and position can be modified as needed. We will discuss how to diagnose implant placement in the posterior mandible. Move the blue axis in both the coronal and sagittal window towards the mandible. Position the blue axis so that the teeth are clearly visible in the axial window. Position the cross-section to the tooth you want to diagnose in the axial window. Rotate the red axis to align with the center of the arch in the axial window. Rotate to align with the nerve. It will be helpful to identify and trace the inferior alveolar nerve. Rotate the green axis to align with the direction of the tooth in the sagittal window. Use the draw nerve icon to trace the nerve. Once a dental arch has been created, it will automatically transition you over to the dental arch module. Rotate the axis and adjust the image in the dental arch for the treatment area. Use the ruler tool to measure the width of an area and the distance between the crestal ridge to the alveolar nerve. In the implant module, the simulation should be based on the length measured from the dental arch module. Select the Manual button and choose the icon with the number that corresponds to the tooth. Left-click and drag the mouse towards the apex to match the intended length of implantation. Implant angle and position can be modified as needed. We will discuss how to diagnose mandibular third molars. Move the blue axis in both the coronal and sagittal window towards the mandible. Position the blue axis so that the teeth are clearly visible in the axial window. Position the cross-section to the tooth you want to diagnose in the axial window. Rotate the red axis to align with the wisdom tooth in the axial window. Rotate to align with the nerve. It will be helpful to identify and trace the inferior alveolar nerve. Use the draw nerve icon to trace the nerve. Once a dental arch has been created, it will automatically transition you over to the dental arch module. In the dental arch module, move the axis towards the wisdom tooth in order to diagnose the distance between the wisdom tooth and the nerve. This concludes our guide to using the One3.